come, and I'd like to welcome everyone to this webinar presented by Choral Canada, the national voice of the Canadian choral community. My name is Joel Tranquilla, and I'm a member of Choral Canada's Advocacy Committee, as well as a past member of the board. I'm joined today by Juliette Davids, and together we will be your moderators for today's presentation. Julia and I are also the conductors of the Canadian Chamber Choir, and we're honored to be a part of this important discussion. The CCC and its members are spread out across the country, and so we've been acutely aware of the effects of COVID-19 on the choral community, both nationally and locally. I want to acknowledge the North America and Europe, and for advocating fiercely for the performing arts sector across the country. The Canadian Chamber Choir has had the privilege of being something of a connection point between the professional and amateur singing. It's important to remember that we are all in this together. There are just a few housekeeping items. Please ensure that you have so this is a lot of repetition for you, I'm sure. You might notice, though, that the chat function has been set to a limited setting. You'll only be able to chat directly with our co-hosts. If you do have a question during Dr. O'Keeffe's presentation, just select the name Heather in the chat, and you can send your question to Heather Fraser. We'll try to get to as many of those questions as we can, and thank you to those who submitted excellent questions in advance. And now I'm pleased to introduce the President of Choral Canada, Kelly Walsh, who will bring us greetings from beautiful Newfoundland. Kelly.
Thanks so much, Joel. Good evening, everyone. On behalf of the Board of Directors of Choral Canada, I'd like to welcome you to our webinar. Thank you so much for being with us tonight. We would like to acknowledge that we are on the traditional territory of many nations in this country, and we are grateful to have the opportunity to work, to live, and to meet on this territory. As choral artists, I believe our most powerful attribute is our ability to listen. Listening to those around you, being in community and unity with others is arguably one of our greatest aspirations. That objective starts in our very early choral experiences and is a common thread throughout every diverse choral journey. For many of us, understanding also carries over to many other aspects of our lives and work. Over the past 6 months, I've witnessed an unprecedented national coming together, listening to each other and sharing. As a choral community, we understand that listening truly transforms. Listening has certainly helped carry us through this time, and it will help carry us forward. Tonight, we have the opportunity to come together to be supported through the work of Dr. Juliette and to listen so as to help each other figure out what the coming weeks and months will look like for all of us. As I look at social media posts from around the world, I feel ever grateful for our wise and empathetic community, a community who recognizes and respects that across this diverse country, we all have different contexts. We have different directives, different organizational capabilities, and different capacities for risk management. Tonight, let us celebrate the fact that as a community, we will all cheer on those who take the steps to come together to sing safely, while at the same time supporting those who are unable to do so now and for the foreseeable future. Finally, I'd really like to say to Diana Clark, to Rachel Rensikoff and John Weeb, all of whom will be finishing their terms tomorrow at our Choral Canada AGM. I'd like to take this opportunity to thank you all for your outstanding contributions to choral music in Canada. Thank you, everybody.
Good evening. And now for some information on our presentation tonight. The National Collaborating Center for Environmental Health's vision is to be the indispensable online resource for environmental health practitioners and policymakers across Canada. The NCCEH focuses on health risks associated with the physical environment and identifies evidence-based interventions to mitigate those risks. Dr. Juliette O'Keeffe joined the NCCEH team based at the BC Centre for Disease Control in 2018 as an environmental health knowledge translation scientist, working to synthesize research across a range of environmental health issues to inform practitioners and policymakers. Her previous experience includes delivering environmental and public health research for industry, government, and policymakers in Scotland. She holds degrees in environmental biology, energy and environmental management, and a PhD in environmental science. I welcome tonight Dr. Juliette O'Keeffe.
Hi, good evening, everybody. And thank you so much for the invitation to be with you tonight and to present some of the work that we're doing. I'm just hoping I can get the screen share working for you. You can just bear with me 1 second. I'll just take 1 second to start up there. Okay, so I'm presenting today on a report that we did on COVID-19 risks and precautions for choirs. And this was a scan of the evidence that's out there on some of the notable outbreaks and some of the risks specifically to do with singing and activities that involve vocalization activities and some of the precautions. So just a brief outline of my presentation today. I'll just give you a quick introduction to who the NCCEH is, and thank you very much, Julia, for the kind introduction. I'll just give you a brief overview of some of the notable COVID-19 outbreaks related to choirs, which you're probably very familiar with already. Have a look deeper into understanding some of the transmission risks, the precautionary measures, and I'll have a look at some of the emerging research that's out there. And hopefully we can move on to the question and answer some of the great questions that came through before the webinar, and if there's any tonight as well. So the National Collaborating Centres are funded by the Public Health Agency of Canada. There are 6 NCCs across the country, and there's a different focus in each of the NCCs, whether it's Indigenous health, infectious disease, determinants of health, ourselves being environmental health based at the BC CDC, methods and tools, and healthy public policy. So we collaborate with each other, but we each have our individual focus. So at the NCCEH, our focus is environmental health. So we look at things like contaminants and hazards, food and food safety, outdoor air, built environment, climate and climate change and effects on health, and drinking water, recreational waters. But we also look at emerging public health issues specifically. And since the COVID-19 pandemic began, this has been the focus of most of our work at the NCCs, in particular for us. So our work is largely associated at looking at the routes of transmission in different settings, evaluating the effectiveness of different control measures to reduce transmission. And we have a whole collection of COVID-19 resources for environmental health. These are available at the website, so please come along and have a look to see what is there. And you'll find things on various types of measures to control transmission. We've looked at barriers, ventilation, masks, hand sanitizers, disinfection technologies, also looking at different types of environments. So multi-unit residential buildings, encampments, indoor and outdoor spaces, some things to do with outside activities such as cycling and much more. So we keep building on our resources all the time. So what we wanted to do with the choirs was to look at what was out there in terms of the notable outbreaks, but also help to understand what made outbreaks of choirs different. And I'm sure some of you are very tired of hearing about the Skagit Valley, Washington case, but this really kicked off the media reports and a lot of study into indoor spaces in general. So we know that there was a large number of people that were infected, 3 hospitalizations and 2 deaths at that event. What was unusual was that there was some awareness of some of those control measures, such as avoiding physical contact and handshakes, that type of thing. Many of the members used hand sanitizers, but we know it was a long duration. People were singing close together. There was limited ventilation in the venue. Some of the other notable events that appeared in the media came from elsewhere in Europe, the Berlin Cathedral Choir with 60 eventual cases, and the Amsterdam Mixed Choir, 102 cases. More recently, there's been a publication out detailing some of the events related to choirs in France, and I've noted that particular reference in the list of references at the end. Some of these events, we don't have the full detail yet about the venue, the number of people, the type of ventilation, so it's a learning process about what happened in each of these outbreaks. What is common of all of these is that they were in that time period in early March, late February, when there was less awareness publicly about the types of risks associated with COVID-19 and some of the measures. But outbreaks have occurred in other group settings where there was no singing. So why are choirs so special? And this was what we wanted to look at in our report and what we're keeping an eye on as well. So this table below here is just looking at a study that looked at published outbreaks up until April 2020. And of course, this is out of date now, but it was in the early days looking at where were the most outbreaks. And what we see is households and shared accommodation were definitely places where there was a greater occurrence of outbreaks, and other places where there was interactions, close environments, etc. So when we wanted to dive a little bit deeper into this, it was looking at what were some of the common factors of outbreaks and get some clues about the relative importance of different types of transmission. So many of the common factors in these outbreaks, they were largely indoor spaces, crowded, lots of close contacts, many interactions, whether it was greeting, talking, cheering, shouting, sharing of food or objects, long durations of interactions. Many of the spaces were poorly ventilated, and there was prevalence of community spread. So this is interesting to consider what was different with the choirs. And what we find with some of these outbreaks is the secondary attack rate was really different. And that refers to the number of people infected as a result of an initial case. And so for households, for example, the literature so far has showed us that the secondary attack rate's around about 15 to 20%. In other types of settings like meals or dining, it's around about 18 to 20% as well. With the Skagit Valley case, it was around about over 50% for the confirmed cases. And if you take into account the possible cases, it's nearly 87%. So the secondary attack rate was quite high for these types of events. So if we're looking at how the main routes of transmission go for COVID-19, you're probably well familiar with these. It's primarily through respiratory droplets. The large respiratory droplets resulting usually from direct exposure when you're in close contact with an infected person. And those are activities that cause sneezing or coughing. That's what releases those large droplets. Smaller respiratory droplets can also be released from close or result in exposure from close contact, but can also accumulate. Those are smaller droplets that are less than 5 micrometers in diameter. Contact with contaminated surfaces and fomites followed by contact with your nose, mouth, or eyes is also a potential route of transmission, but we don't know how significant contact transmission is. It's probably more to do with the droplets than it is to do with with contact transmission. So in that droplet transmission, particle size is quite important. And we have the categories of large droplets and small droplets or aerosols. And there's a bit of a scale here of droplet sizes of what constitutes an aerosol and what constitutes a large droplet. And usually we're talking about particles that are between 5 and 10 microns and above are larger droplets. So I have illustrated there a red blood cell, and that's around about 10 micron in diameter. In contrast, those smaller droplets are we're less than 5, but a lot of them are around about 1 micron in diameter. And just if you see that little yellow dot towards the bottom of the page there, that's the size in comparison of one viral particle, which is about 100 nanometers or 0.1 of a micron. So you don't really see viruses floating around on their own. They're usually associated with these droplets. So the large droplets, we know that they are more likely to fall to the ground at a short distance. They're released by intense but less frequent events, coughs and sneezes, and they're usually expelled by symptomatic persons. And if they cause infection, it's usually through the upper airway. Smaller droplets, on the other hand, they're less likely to fall to the ground at a short distance. They can persist in the air for longer and accumulate. They are generated through potentially less intense releases like breathing and speaking, but can also be generated in a burst of coughing or sneezing. And they can be generated by symptomatic and asymptomatic or pre-symptomatic persons. And they have the potential to reach the lower respiratory tract. So just putting together what we know about the settings, the types of outbreaks, and where transmission has been more common, as well as what we know about the risks that are associated with gathering in groups in these indoor spaces, as well as the release of particles. We wanted to look at, what was it about choirs? So choirs, you have risks associated with large gatherings. And this is stuff we know already about gathering in groups. There's risks are enhanced with a close contact, when greeting, talking, sharing of items. That increases your risk of exposure to large respiratory droplets and those shorter range aerosols. There's also the risks with large numbers for prolonged duration, which increases your exposure to accumulated aerosols. And where there's limited ventilation, that reduces the dilution and dispersion of aerosols. Sharing of surfaces and objects is also potentially an issue where there's a lot of people, but again, we don't know the degree to which exposure via fomites actually results in widespread transmission. If we look specifically about singing and vocalization, we see an increased emission of droplets. And there's a combination of processes that can contribute to a variation in the quantity and the size of particles that are released during vocalization. So the main mechanisms for producing droplets during vocalization are fluid film burst in the bronchioles, and there's probably better people than me to explain the ins and outs of how the vocal cords work and how vocalization affects the different parts of your vocal system there. But there's various mechanisms. So it's when you inhale, you take in air. When you exhale, your bronchioles collapse and the mucous membranes stick together. And on inhaling again, those split apart, and that's when fluid film burst creates these smaller droplets. Droplets can also originate in larynx, in oral cavity, and depending on how people speak and enunciate, you can produce droplets that way. So quantity during vocalization of any type, according to the research, releases a higher concentration of particles than breathing. Speaking in turn releases more than breathing, and singing in turn releases more than speaking. Particle release seems to be affected by volume, so the louder that you are vocalizing, the more aerosols that are being produced, but also the vocalization style can affect the number of particles that are released, and certain types of deep exhalation and rapid inhalation. There's also evidence of super emitters, and some people are able, well, they produce more emissions than others, up to are up to an order of magnitude greater emissions for super emitters than their peers. Studies have also found that the vocalization can produce a range of particle sizes, although those smaller particles dominate. So you're producing more particles and more of them are small. And recent studies have shown that about 80% are less than 1 micron in diameter. So these can remain suspended and travel further than large droplets, and smaller droplets are much more likely to penetrate the lower respiratory tract. So we looked into some of the precautionary measures, and there is much more consensus gathering now about what are the best precautionary measures, both for gathering groups, but also to look at this reduction of aerosols and small droplets accumulating in spaces. So maintaining distancing remains one of the most important precautionary measures, and we all know about the spacing of 2 meters between people in a shopping line, and we maintain that in other areas where you're participating in group activities. That helps to reduce the spread of these large respiratory droplets that will fall to the ground, and can also help to reduce some of the short range transmission of the smaller droplets. It's easier to maintain your distance in a larger venue or larger rooms, and your distance should be maintained for all activities, not just while singing, but consider your entry and exit points, your warm-up spaces, potentially your breakout rooms and bathrooms, and how you can maintain distancing throughout your activities. Additional barriers and partitions can be considered where it's practical to do so, or where it's difficult to maintain distancing. And I think probably talk about this in the Q&A a bit more about partitions. Minimizing the risk can also look at reducing the density of faces is a good way to look at it. This is reducing the loading of infectious particles, increasing the dilution and dispersion of accumulated aerosols, and the shorter duration it breaks between allows time to clear the room and allow for potentially infectious particles to disperse. Breaks should not be something that then during your short duration of 30 minutes you gather in a room for a coffee break that results in minimizing distancing or something like that. So in the Amsterdam outbreak, for example, the rehearsal space itself was a good space. People were spaced out quite well. However, during the break, there was a coffee lineup where people were crowded in, getting their coffee in between. So if you're looking at doing breaks in between your 30-minute rehearsal or performance, think about where those breaks are going to take place and who's going to go to different break areas. Now, about ventilation, and this is probably something that could do a webinar on its own, really. But ventilation is quite important, and you've heard it many times about outside is better, and where it's possible to do so outside, have your rehearsals, performances outside if you can. This is feasible when the weather is good, but we're coming into fall and winter, and even in some of the areas of the country that are very hot, outside is not always a practical option. So there are some maybe adaptations or kind of out of the box thinking that might be needed for other outdoor spaces. Some people have been looking at covered open parking garages as a covered outdoor space, but there's other areas that you can look at, tents and things, but not with sides. But if you can't be outdoors, you want to be in an indoor space that's big and has lots of natural ventilation or mechanical ventilation. And I put high ACH on there, and that's high air changes per hour. And that there's various guidance on what type of air changes per hour would be suitable. What device an ASHRAE is a good resource for looking at that. What we really want to avoid is confined, small indoor spaces with no ventilation. And if you are in those types of spaces, you really want to minimize the number of people that are in those spaces, or minimize the time that you're spending there. Alongside these sort of physical venue type issues, we looked at personal measures as well. And for most of the outbreaks that we saw in those notable outbreaks I listed earlier, there were symptomatic people that were present, and they were mildly symptomatic. So it's important to emphasize if people are symptomatic, even if it's mild symptoms, or they were potentially exposed to a person who could be COVID positive, or maybe somebody who's returned for travel, maybe consider whether they should be interacting with others. Also, high risk and susceptible persons want to consider their comfortable level of risk if they're going out and try to avoid spaces where there's a lot of people in confined areas. Face coverings, if possible, to wear them at all times when you're around others, particularly where close encounters are more likely, or you're going to be in a space for some duration. But we'll talk a bit more about masks and the new types of masks in the Q&A. And the other basics that we already know: hand hygiene, avoiding close contact, sharing of objects, etc. So when you bring these issues together, how do you decide whether your venue and your event is safe? And risk assessment is probably the way you want to go about this. And there are various approaches. So I've just put a screenshot of a couple here. I won't go into a lot of detail, but the WHO one on the left top, the Span and Richter, that's from the Freiburg study. They have a risk matrix there as well. And the Public Health Agency of Canada has various risk tools for community transmission approaches. And basically you're looking at what is the risk level of your participants, the venue, the activity in terms of the number, duration, types of things you're doing, as well as what's the local risk in terms of community transmission. Is there widespread community transmission, or is the outbreak the pandemic relatively under control where you are? You then want to look at what mitigation measures are possible to reduce any of those risks. And most of those will do with the venue, as well as personal issues that people can take on themselves, whether it's mask wearing, distancing, and keeping away if you're ill, and keeping away if you're susceptible. Putting those together, you decide, do those mitigation measures bring down risk to an acceptable level? And consulting with your local public health authorities about some of these things to decide whether your mitigation measures will eliminate or reduce risk sufficiently to make the activity safe. Now, just want to briefly touch on some of the emerging research, and there's probably not a lot of time to go through everything that's out there right now, but there's some interesting things happening, and we're continuing to look at a lot of this too. So I'll just briefly touch on a few things. So you're probably widely aware of the University of Colorado and International Coalition for the Performing Arts study that's been carried out in the US. And this is looking at a wide range of issues around performing arts with instruments and singers. So I just wanted to highlight a couple findings out of their preliminary results. Now, these are not published in academic papers, so they've not been subject to peer review yet, but I don't think it'll be too long before some of this comes out. So the first chart there at the top of the page, looking at the squiggly blue line, was looking at aerosol release during different vocalization activities. And this is a soprano singing. And we're looking at the higher the bar, the more particles have been released. And during different vocalization activities, whether it's scales, warm up, we see an increase in particle release. And then during singing of both a hymn and a pop song, we see that there's a release of particles. What is interesting about this is then they tried the singer with a mask on, and that drastically reduced the release of particles. And these are particles between 0.5 and 20 microns. And in this particular study, it looked like singing with a mask wasn't that much different than sitting and breathing. In the visualization below, we're looking at the indoor case study that is modeling the risk of infection. And so the red color indicates 100% risk of infection, where down at the bottom, the dark blue is no risk of infection. And this particular image is looking at singing with and without a mask. The top is without a mask, and we see over different times of 10 minutes, 30 minutes, and 60 minutes, you can see how the risk of singing without a mask increases the potential infection risk. And this is, of course, an infected person singing in this particular case. Down below, we have a perfectly fitted medical grade surgical mask. It's not an N95, it's your blue type of 3-layer surgical mask. And we see that over time, there is still an increased level of risk, but the mask wearing has significantly reduced that. So the link to all of this is in the references at the end. There's also a lot of research coming out of Germany, and the link to the Span and Richter risk assessment of a coronavirus infection. They're updating this document regularly. They've highlighted a number of studies in their report, and I've just listed a few of them here that were of interest. But the visualization I've placed there is from Merv et al. And this was looking at a release of particles, again, by a slightly different method, during the first bar representing breathing, the middle bar representing speaking, and the rightmost bar representing singing. And we can see that with different vocalization activities, you have an increased level of particle release. They also compared, so we have 8 singers they looked at. The red are female singers, the blue bars are male singers. And although there's variation between all of them, on average, the female singers were releasing more particles. This is slightly different to the results of a study that has been undertaken at the Tokyo Metropolitan Symphony Orchestra, where they also compared release of particles between instruments, a male singer and a female singer. Singers released more particles than wind instruments, but in that case, the female singer released less particles than the male bass singer. So there's some variation there between male and female singers, but the key point is really that there is a higher level of particle release, and that just kind of confirms it. Some of the other research that is interesting, though, is looking at maybe how we could measure when you've reached an unsafe level of particle release in an indoor environment. So they're looking at the relationship between carbon dioxide accumulation in a space and aerosol concentration. Also looking at risk assessments for different types of rooms and spaces. Some of the data that we've seen has been brought together from various sources in the literature to come up with risk calculators. And these risk calculators are interesting. They're still in development and mostly are pilots, but they give an idea of taking multiple factors about room dimensions, air exchange, number of people, the duration of exposure, and coming up with some level of the infection risk.
Perfect, thank you.
I just wanted to mention one more thing about masks. Yeah. There is obviously there's the singer's mask, and we've also looked at one recently. It's a clear face mask, and that might be something that the choral community is interested in. Also, it's one that just got FDA approval as well. So what we don't know yet about the singer's mask is, I don't think there's been a lot of study on how effective that is for blocking particles, but there are new innovations coming out all the time. So keep an eye out, and we will be updating our mask document shortly.
Great, thank you. You're right that choir singers do really need to be able to see one another and express with each other. So that's something we're looking forward to getting back to doing, certainly. The next couple questions are about distancing and standing formations, as well as room size. So you spoke about some of this, but I wonder if you could just expand a bit. The minimum distance that singers should be from one another while singing inside a venue. We know about the 2-meter distance, but as you mentioned, of course, particles can float further than the 2 meters, and directionality is something else, of course, to consider. So side to side and also front to back. Could you expand a bit on distancing?
Yeah, so the distancing rule of the 2 meters standard is really about limiting the large droplet spread and some of that short range aerosol projection as well. And that 2 meters is a minimum indoors and outdoors. So outdoors doesn't reduce your need to distance. Wearing a mask is not intended to be an alternative to distancing either, except in those circumstances where it's hard to keep your distance. As far as, between people and next to each other and formation, there hasn't been a lot of study on formation. The Tokyo study that I mentioned, they did look at lines versus different types of formations and didn't find a big difference in sort of what was emitted during different formations there, but there's not a lot to say about whether a curved formation in or out makes a huge difference. A straight line is probably fine, but if you've got multiple rows, make sure that you can distance your 2 meters between rows as well. And it has been recommended in some places about staggered rows. What we don't know, which would be interesting for any of the researchers out there to look at, is what about tiers, and where you've got singers in tiers, and whether the top row is raining down a spread of droplets on the ones below, or whether the ones below are emitting droplets and their thermal plumes are raising it up to the. So this would be interesting to know. As far as those smaller particles in the distance, and we know that they can travel farther than the large droplets, and they can become more dispersed. So in theory, the further you are away from people, it's always going to be safer, but in a closed indoor space, it's not practical. So those other measures to reduce risk, like good ventilation, wearing of masks, those are the things that you have to add, and also that reduced duration too.
Sure. I think some of that formation, some of those considerations are that we're so accustomed to trying to achieve the best sound quality when we're all together, and we can hear each other better when we're in a certain formation, perhaps. But just important for us to remember, of course, as conductors, especially, that we'll be excited to be in the same room together to make music, but we'll have to retrain ourselves a little bit to just adjust what we might want to say right away in terms of what could allow our singers to really get back to normal.
And sure, that face-to-face interaction is higher risk than it is if you were not facing each other.
Of course.
So you can see that in that image from the University of Colorado, where the projection is forward. So if you're both projecting at each other forward, that's worse.
Right. Okay.
Than somebody projecting at the back of your head. You want to go home and wash your hair. But...
Yes. Right. Now, if singers can be spread out even more than the recommended minimum distance, you've mentioned that, of course, in theory, that would be better. How much does it lessen the risk, or do we not really know exactly how much?
Yeah, it's really dependent on where you are and the type of venue. So the size of the space and the ventilation and these other factors, the number of people that are singing and emitting. But maintaining that 2 meters for the large droplets is the most important thing to really consider. There is some looking at sort of the total space that you have allocated per person inside, and 5 meters squared per person is a benchmark that has been used by some agencies. In Norway, for example, they use 4 meters squared per singer. They use 3 meters squared per wind instrument, but that 4 meters squared is plus a buffer depending on how many people you have. So 4 meters squared plus, say, another 10 meters squared if you have less than 10 people. If you have 50 people, then you want that 4 meters squared plus an extra amount of space. So this is more for that total volume of space that you're occupying and the amount of time you're spending there too.
And you've transitioned us perfectly to the room size sort of questions.
Okay.
Could one potentially sing for longer in a bigger space if they were able to have more more space per singer before an air change is required? Or is that, as far as we know, a sort of strict recommendation at this point?
Well, I think the recommendations are meant to be a guideline that everybody can follow, because if you're going to different rehearsals or you're going to different spaces, it's hard to calculate in your head, okay, well, this space is 16.7 square meters, that one's 18.9 square meters, so I can stay 26 minutes in this one, but I can stay 29. So it's to give a good basic guideline that everybody can understand is a bit universal until we know more. But a bigger room is always better if it allows people to spread out a bit more. And about air changes, like the building codes require different kinds of settings for different levels in different types of venues. And it's usually indicated, as I mentioned, about the air changes per hour for those spaces to be continually ventilated. But a better metric maybe to think about is the liters per second per person. So the more people in the room, the more airflow should be occurring regardless of the room size. And it's important to note that ventilation protects people from the buildup of aerosols that could contribute to infection, but it doesn't protect from that close range droplet transmission. So you don't want to be gathering in an unventilated environment, but even if it is ventilated, you need to think about spacing out or using barriers to prevent that droplet transmission.
Great, thank you. And there were questions certainly that were related to specific spaces. A lot of choirs, of course, have been accustomed to rehearsing in older church sanctuaries and that kind of space, which might seem to have an appropriate amount of space, but not with adequate ventilation. So perhaps we've heard about that, of course, and I want to make sure that we have time for our recommendations from you, but that's just something that we all just, of course, need to bear in mind that, as you say, it has more to do perhaps with the quality of the exchange than some other factors.
Yeah, I mean, and it's a big issue with older buildings because a lot of older buildings aren't designed with any kind of mechanical ventilation. But that doesn't mean it's impossible to ventilate older buildings. Whether you're opening doors and windows to create some kind of an airflow, and it's a directional airflow, that's important. But you want to be careful not to cause more problems, maybe if you have a fan. So you have to also remember that ventilation is not just about moving air around. It's not recirculating air with a fan just to move it. That can cause other problems. It's about replacing inside dirty air with outside clean air. And so for some of these larger spaces, it's maybe just a way of figuring out how you can ventilate. Maybe it's about putting a directional fan near a window that's directing it to an exit point at the other end of the room or something like that. It's important to maybe work with the people that run the facility. Maintaining systems too is important. So whether you're owning the building or running the building yourself, or you're going to a venue that is operating it, it's good to get acquainted with what ventilation options are there in this new time.
Great, thank you so much. We'll go on to some questions related to recommendations.
Yeah, I think many of us are wondering if you have different recommendations between singing with adults compared to singing with children. And I know you mentioned that as a possible area for future research. And you've also mentioned that you have to consider the risk of the age group that you're working with. So can you elaborate a little bit? Do you have anything to add on children versus adult populations?
Yeah, I think the principles are basically the same for everyone. Sometimes it's a little bit harder with kids. Things like wearing masks is maybe harder to get them adapted to it. Maybe they're not used to staying away from each other so much. Kids want to interact, they want to stay with their friends. So it's kind of working with your group, and maybe it's about reducing the size of the group to start with to get kids used to a new way of doing things and help them adapt to some of these measures that might be harder to bring in if it's a bigger group and doing it all together. But kids are very adaptable too. We are still learning more about transmission in children, and I think this whole back to school rollout is going to tell us a lot, and is probably going to give us a lot of information about what doesn't work and what does work. So I think just watch this space about schools and how the schools are adapting to return. In terms of sort of blanket guidance, like it's very different across the country by province, health authority, district to district, and school by school, what types of measures they're taking. So
Thank you.
yeah.
Thanks for bridging exactly, this is beautiful, into our next big question. I think many people have felt very frustrated by their local and provincial guidelines for a variety of reasons. So I wonder if you could tell us what would be a good avenue for getting this latest scientific information to the policymakers, and particularly about, efficacy of vocal masks or any of these distancing that you've talked about that are really specific to enabling singing. I know Choral Canada has been a strong advocate, but what can individuals in their own communities and provinces do to advocate?
Mm-hmm. I think these groups have been very effective, Choral Canada and others, at communicating actually with the public health authorities, and probably better than a lot of other types of community, I would say. And that's the reason why you've seen documents coming out of the likes of Alberta Health Services, Public Health Ontario, across the province that are specific to singing and wind instruments, and continuing to speak to your local public health officials about these things is working. So keep doing it. I mean, organizations like ourselves, we're always looking for emerging topics, and we keep an eye on it. We also take sort of field inquiries from people that have a specific public health issue. So sometimes you've maybe communicated with your public health official and they've come to us and said, could you look into X for us? So that's one way. There are a lot of resources out there already. So it is useful for, if you go to a public health authority or somebody else, decision makers, that you've already looked to see that that's not already out there, because that saves everybody a step. But in terms of masks, partition, these sort of transmission risks and mitigation measures, we're looking at that. Public Health Agency of Canada is looking at that. There's a good resource through our sister NCC called the National Collaborating Centre for Methods and Tools, and they have an evidence repository where there's research from across the country that's being done is being collected there. So different types of evidence reviews are being collected there. So that's a good place for us to kind of collate what we know, and also to use that kind of body of knowledge to communicate with others.
Great. We have some more questions that are coming in. One that we had to sort of skip over earlier, but I'd like to cycle back to ventilation. How effective are portable HEPA filters in a room that doesn't have windows?
So these can be effective, and they have been shown to be able to remove particles from the air, but they don't necessarily replace ventilation. So you don't want to rely on them solely as your only means of air cleaning. So you also maybe need to look at where you place them in the room. So you don't want to put it in a corner away from people. They should also be maintained, and filter seals need to be checked. And if it's integrated into the mechanical ventilation system, then a specialist should be involved there. But if it's a portable system, you maybe want to look at calculating the volume of the room and compare that to what they call the clean air delivery rate, or CADR. And so how much air can that potentially clean? If you've got a very small device in a very large room with a lot of people, it probably won't make much impact. So make sure, if you are using this, that it's spaced, or it's sized to the space that you're using. There are other types of air cleaners out there that have, instead of filters, they might have UV disinfection. Those do a similar type of job, but they don't have a filter always. They might have a filter as well as the UV, and they can be effective. But again, it depends on how big of a space you're trying to ventilate, or sorry, clean with ventilation.
Piggybacking on that, how does air conditioning affect ventilation?
So air conditioning, it really shouldn't cause any issue unless it is fully recirculating air. So circling back to that outbreak at the restaurant in China where there was people infected, that had to do with an air conditioning system that was directing airflow from an infected table over to others in that restaurant space. And there was no, well, very little fresh air being recirculated into that system. It was pretty much just a recirculating system. So just taking your infected droplets and moving them around the room. So if the air conditioning is part of a system that has a good level of clean air, then it's probably all right. The direction of flow, you just want to be careful too about if it's blowing directly at somebody towards somebody else, how that's working out. So if you have a built-in air conditioning system, speak to your ventilation HVAC professional and get their advice.
Great, thank you. We have another question that I think is fantastic. I do feel it may be outside your field of expertise, but I'm going to pose it because I think it's great. And I think Dr. Laurier-Fagnon may want to consider it if it would fit in his experiments coming up. And that's, is the amount of particle transmission gender-based? You mentioned a soprano and a baritone, or is it by the section in which the singer sings? So if we had a boy soprano or a trans male who sang alto or sings alto or soprano, does it have to do with pitch level, or does it have to do with physiology of gender?
Yeah, again, other than the data presented there by Merv et al., there's not been a lot of comparison of males, females. In the Tokyo example, there was just the two, soprano and baritone, but probably need to look at that a bit more. If you have a bigger set of lungs, you're going to be able to expel more air, but I can't authoritatively say I've looked into this in any detail other than the data presented there.
Okay, thank you so much. You've covered so many things. We've got one last little question we'd love to ask you. People are asking about where to find the risk calculators that you had in the slides. So I think if we provide those slides to people and your references, they'll be able to find those. That's great. But one of our questions is, if the singers are masked and the room is bigger, can we sing longer? Sorry, Dr. O'Keeffe, did you hear that question? You froze for a moment.
Yes.
We may have maxed our questions.
Oh, sorry. Okay, I can hear you now. Try one more time.
Great. If all our singers are masked and the room is larger, can we sing longer than that 30-minute duration?
Good question. I think it's sensible to try things out for the 30 minutes. I mean, the 30 minutes is not a hard and fast rule. It's a guidance from one study, and actually in other locations, they're looking at 15 minutes as a guideline.
Yeah, I certainly, considering with my singers, how it feels singing in the mask and being so far apart, 30 minutes is maybe all I'll get out of them for a while. Okay, I think we're going to move on. I just want to thank you again, Dr. O'Keeffe. You've given us so much to think about and consider, but also some really excellent hard facts and a sense of where the research is going and what to keep an eye on. For some of us, it may mean delaying activities a little longer until we have more certainty here, but I think you've given us a lot to help us consider our own individual situations. Thank you so much.
Next,
Thank
we'd
you so
like to
much.
introduce Laurier Fagnon, and those of you wondering about a Canadian study on singing and the transmission of COVID-19 will be pleased to learn that Laurier is part of a team at the University of Alberta leading a study right now. Dr. Laurier Fagnon has devoted his career to understanding the complexities of the human voice in the context of choral singing. As director of the University of Alberta's Vocal Acoustics Lab and possessing a doctorate in choral conducting in vocal production and acoustics specialty, a master's in vocal pedagogy and a postgraduate certificate in vocology, Laurier has a deep understanding of the functioning of the human voice in both solo and group singing contexts. He will design the vocal aspect of experiments and help in the analysis of results from the study at the University of Alberta. Laurier, welcome, and over to you.
Thank you, Joel, and hello everyone to all the 250 participants who are here with us. And thank you especially to Dr. O'Keeffe, who had an absolutely exceptional presentation. Thank you for all of the information that you gave us that was so clearly presented, that was just a ton of information, but so intuitively done. Thank you so much. You've given us a few questions, but a lot of answers as well. Much appreciated. I love to learn, and sometimes particular contexts give us unique opportunities for learning. Did I ever think that I would be using my knowledge on the voice and vocal acoustics to study the droplets and aerosols that come out and can infect people? Absolutely not. But when we were hit with COVID-19, I thought I had a responsibility with the equipment that I had and with some of the people that I knew, to try and add to the knowledge base that was starting to be accumulated, because there is absolutely nothing that has been done on the singing voice and on what comes out while singing in terms of dispersal of aerosols and droplets prior to COVID, of course, and governments have recognized that and have come to the realization that something must be done. So we're trying to do something. Is this study essential? There are other studies out there. Well, in science, the more information that you can find and accumulate, and the more often that you can replicate something, and the more often that you can bring data to the foreground, the more successful you can be, and the more confirmation you get. And also because in Canada, we have an incredible choral community, a very diverse and rich and complex choral community. And I think it is part of our responsibility to contribute to the global exploration of this problem that has hit us, but for which we hope there is a solution. Anyways, we are excited to get started. How is this study going to be original, different than others? First of all, we will be looking exclusively at the singing voice and not at any instruments, or we will be looking at different types of singers. So Julia, the question that you mentioned of gender and pitch, we will certainly be looking at that. We will be looking at 4 sopranos, 4 altos, 4 tenors, 4 basses. And we will also be looking at the difference between more professional type of singing and amateur type of singing, or singers from professional choirs, let's put it that way, and singers from amateur choirs. We'll be looking at the difference in modes of production. Some singers who sing with a very clear, focused voice, where the vocal folds approximate very effectively against the breath, and there is less breath flow. And so, yes, they can have a good vital capacity in their lungs, but they don't expel much when they sing. Lots of acoustic energy, but not a lot of breath flow. We'll be looking at the difference between that and someone who might have lower acoustic energy, but more breath flow. And what do the aerosols and droplets flow on? Is it the breath flow? My hypothesis is yes, as opposed to the acoustic energy and sound wave. So we'll be looking at that. We'll be looking at the difference between of course, coughing and sneezing and singing and humming, and speaking, of course. We'll also be looking at masks and their acoustic effect on sound, on the intelligibility of what people are singing, and on the acoustic effect of the vocal spectrum. Are all of the harmonics still there with different types of masks? That will be one part of the study. Will this take 2 weeks? No, it will take a little longer. Another thing that will take up quite a bit of time, we're looking not just at the voice in terms of experiments. We will be looking at that and capturing in the experimental environment with these 16 singers with a multi-dimensional laser field and high-speed photography with the professors in the Department of Mechanical Engineering, who are very excited about this study. They get to play with all their toys in a fun way. So we'll be looking at the droplets and aerosols as they actually come out of the mouth. And we will also be, one of them is an expert in that. The other mechanical engineer is an expert in computational fluid dynamics and computer modeling. So he will be taking what comes out of the mouth during the experiments and then extrapolating and expanding on that, on what actually happens in singing. And build computer models that can extend that, so that can change the size of the room, that can change the amount of ventilation, that can change the size of the human being, and how much breath is coming out, and change a multiplicity of factors, so that we don't have to have people in an experimental situation for hours and hours or days and weeks. So that is a very interesting way of looking at things. And we also have an infectious disease specialist who happened to be in the hospital in Hong Kong in the SARS outbreak in 2003, and was one of the main researchers there, has tons of experience, has written 180 articles on infectious diseases through aerosols, passed on through aerosols and droplets and contact. So he will be an indispensable person on this team. So it will be very multidisciplinary. I'm going to have fun with the voice. They're going to have fun with measuring things and building things that will be able to look at things in a very important way. So I hope that gives you a quick idea. I don't want to take too much more time. I was asked to share my screen for a couple of pictures, but if I can just show you one type of thing that we'll be doing with the computer modeling, is we'll be looking at, this is a sneeze, someone sneezing, and these are the green and the bright colors in here are the droplets, and these are the aerosols. And so in the with a very violent, sneezing is extremely violent, singing is nothing like that. You get a real plume coming out, and then the droplets, as Dr. O'Keeffe said very well, drop very quickly to the ground before they go too far, and the aerosols tend to linger. Now, this is a sneeze, and singing it would not be going that far. So we're going to look at this type of thing, in a choral environment, and how far forward it goes, but also how wide it goes. Certain studies have already shown that it goes farther forward than it does wide. And we're going to look at that, and we're going to be able to see how ventilation affects that. And all of the computer modeling will be based on actual experiments. So we hope to find some very interesting things, but we will have to, of course, we will have to present what we do find. I hope we find something that's great for choral singing, and I hope that it will enable us to open up sooner. It is certainly all of our hopes, and we will keep you informed. And thank you for being interested in this study and supporting this study. And I look so forward to getting more involved in it in the weeks and months to come. Thank you.
Oh my goodness, thank you so much, Laurier. This is just right my interest area. So thank you. Laurier also let slip that he has lasers. So I'm very interested to see what happens with the lasers. Listeners on this call tonight, we will all have the opportunity to donate to this research. We'll be sure that you get the link to that campaign. But as stakeholders with a vested interest, it is up to all of us to support our colleagues so that we can ensure that Canada's voice is heard by our international vocal community. Okay, well, this concludes the formal part of our presentation tonight, but we'd really encourage you to stick around if you'd like to chat for a few minutes. We'd like to thank our presenters, Dr. O'Keeffe and Dr. Fagnon. We'd also like to thank the webinar organizing committee. Diana Clark has done so much work. Thank you, Diana, Megan Gila, and Heather Fraser, along with Choral Canada staff, Zina and Neela, my co-moderator, Joel. Just want to thank you all for making this possible today. I took a lot of notes myself. This is going to be very helpful. So whether or not the science and recommendations presented today were new to you, there's still a lot to process as we apply this to our own situations, communities, and ensembles. We know that some of you are going to want to chat with colleagues across the country. So at this time, if you'd like to be in a breakout room to process, visit, chat, please stay on for another 10 or so minutes. For those of you who are already planning to attend tomorrow's annual general meeting, there's a group, this is your group reminder to check your email for the local time. For those of you leaving the webinar now, we wish you all the best and thank you so much for joining us tonight. For those of you who are going to stay, we're just going to wait a few seconds. You'll be put in a breakout room shortly. Feel free to chat about what you've heard or share ideas, or you could model your singers' masks. And then you can sign off from your breakout room and we'll give you advance notice just before we close the room in about 10 minutes or so. Thank you all so much. It's been a joy to be with you tonight.
Thank you, Julia and Joel. You were fantastic, and Diana and Dr. O'Keeffe and the whole team.
And thank you all. I'm going to end the meeting for everyone now, and our committee can touch base later.
Perfect. Thanks, Diana, for everything
Thanks so much. Take care, everyone.
Bye.